The best of RSNA is coming to you in these two exciting new Spotlight courses. Explore head to toe emergency imaging in the virtual Spotlight course, Best of RSNA Insights, Innovations, and Interactive Learning in Emergency Radiology, taking place April 3rd and 10th. Or join top presenters from RSNA in Istanbul, Turkey for the in person Spotlight course, Expert Insights on Emergency and Abdominopelvic Imaging, on June 28th and 29th. Learn more about both courses and register at rsna.org/spotlight.
Welcome to the RSNA Radiographics podcast. This is Dr. Refky Nicola, co-host and one of the assistant editors for the podcast from SUNY Upstate Medical University in Syracuse, New York. And today on the podcast, we are discussing the article by Bentley et al. From the University of British Columbia regarding the topic of teaching radiology, an evidence-based overview for radiology residents. I will be highlighting some of the segments from the article. Residents are involved in educating various learners, including junior residents, medical students, and other healthcare professionals in different clinical settings, such as during daily rounds on call, as well as during research, mentorship, and other extracurricular activities. Approximately one-third of clinical teaching is done by residents who may dedicate up to a quarter of their time to teaching. Instruction delivered by residents has been demonstrated to be just as effective as by faculty. Residents enrich medical education by presenting a unique perspective on teaching, as they often better understand the potential challenges of educational content, and they can offer a more effective method to bridging knowledge gaps. Numerous benefits arise from residents engaged in teaching. First, teaching reinforces residents' learning by solidifying their knowledge as they articulate their understanding of educational material, thereby enhancing knowledge retention. Second, teaching improves resident communication skills by enabling them to synthesize information and present it in clear and a concise manner tailored to various levels of learners while allowing them to give feedback to their students. Finally, teaching fosters residents' professional growth by nurturing a culture of knowledge sharing and promoting a mindset of continuous learning while they contribute to the educational development of their peers. Graduate medical education accrediting bodies such as the ACGME have highlighted the importance of residents acquiring teaching skills. The ACGME views teaching as one of the several core competencies that residents must demonstrate upon completion of their graduate medical education. There is an increasing demand for educational resources and opportunities for radiology residents to enhance their teaching skills, although these resources can vary by institution, which thus leaves many radiology residents feeling unprepared to teach. In this article, I will highlight the evidence-based overview that is provided by radiology residents to develop and implement their skills as teachers. What are some of the key concepts that can help radiology residents? Well, first, establishing educational goals. It's important to establish educational goals such as during teaching encounters or daily rounds, which can effectively encourage learning. The purpose of clear and defined educational goals is to allow learners to better navigate medical education with a structured framework and enable teachers to guide learners to specific educational outcomes. These goals also foster valuable qualities such as responsibility, accountability, and time management that are necessary to successfully advance in medical education. The establishment of clear and defined educational goals encourages active engagement of learning in their medical education and empowers them to take initiative in determining their educational experience and adapting these to their own learning needs. One method of establishing educational goals is to using the SMART method, which stands for specific, measurable, attainable, relevant, and time-based approach. This model was developed to assist learners in establishing educational goals. An example of an educational goal for a teaching encounter using the SMART method would be that over the next hour, the learner should be increasingly familiar with the differential diagnosis for patterns of lung nodules at the end of the education encounter. The learner will be able to recall these without mistake or omission. The next educational concept is supervision. Appropriate learner supervision enables the learners to achieve their required competencies while ensuring safe patient care and may guide the educational content of a teaching encounter. Supervision can either be direct or indirect. Direct supervision involves the physical presence of a teacher who's actively engaged in the patient care. The teacher can directly observe and guide the learner while providing feedback and intervention as required. Indirect supervision involves oversight by a teacher who's not physically present during the patient care being provided by learners, but who is available for guidance and remains responsible for the oversight of the learners and safety of patients. Competency. Effective feedback is integral to improving the competency of learners. The author suggests that radiology residents should aim to incorporate various types of effective feedback methods that have been described in the medical education literature. Feedback should be specific, focused on particular areas of performance or knowledge, be actionable, and allow for opportunities for improvement. Feedback should be provided to learners and should be delivered in a clear and concise manner so it's easily understandable and timely so that learners have opportunities for improvement. Various models of feedback are described in the medical education literature that radiology residents may use to develop effective feedback, including the sandwich method, the Peloton method, and the situation behavior impact model. Individual learning styles and models should be adapted appropriately during each teaching encounter. Feedback should also foster a dialogue that encourages the learner to ask questions and seek clarification on the feedback they have received. Feedback should be provided to learners continuously that regularly determines their progress and facilitates their long-time development of competencies. How should radiology residents develop their skills as teachers? Well, there are various resources that help radiology residents develop their skills as teachers, most often that are structured. Educational programs encompass a multifaceted approach, provide foundational learning through didactic lectures, interactive and experiential learning. Faculty mentorship can also serve as an important resource for residents who want to develop their skills as teachers. Faculty can provide feedback on resident teaching practices and offer insight and advice on teaching practices, further guide resident continued growth and professional development. Faculty mentorship may also provide residents with professional development opportunities to improve their teaching practices, career guidance, and medical education network opportunities. Institutions may consider faculty mentorship through established structured mentorship programs among faculty and residents with similar interests in medical education. Residents can also use other resources, such as textbooks, educational articles, and online modules to develop their skills as teachers. Such resources can cover a wide variety of topics relevant to their medical education, which residents may use to deepen their foundational knowledge. Additional resources such as online platforms, digital resources, and social medias can provide flexibility and accessibility to radiology residents to use those resources at their convenience. Residents can also consider taking on additional educational opportunities or medical education initiatives in their graduate medical programs, such as curriculum development of a scholarly endeavor or mentorship to further develop their skills as teachers. A clinical education program provides a structured career path for radiology residents passionate about medical education and interest in educational leadership. These programs recognize radiologists as both clinicians and educators and facilitate professional development and advancement in both realms. Radiology residents may also pursue formal programs in medical education, such as the completion of a graduate degree or certificate. How should radiology residents implement their skills as teachers? Once the radiology residents have learned how to develop their skills as teachers, they need to be able to implement these skills. A very structured framework has been described, including the 5-step micro skills model of clinical teaching. A structured framework helps Radiology residents enhance their effectiveness of their teaching by finding opportunities to facilitate meaningful teaching encounters for learners to develop their required competencies. Teaching provided by radiology residents enriches medical education and offers multiple benefits to residents. There's a growing demand for educational resources and opportunities for radiology residents to develop their skills as teachers, but they can vary greatly by institution. Residents should develop and implement their skills. Their teaching should be increasingly supported since it is an integral role in the medical education. Please see Table 1 for models of a delivery of effective feedback, as well as Table 2 for the 5 micro skills model of clinical teaching. You can read the entire article in the February 2025 edition in the Radiographics Journal. Thank you very much.